lip augmentation. I don't think there's a better filler on the planet than liquid injectable silicone for the lips. In my hands, lip augmentation is completely natural looking and soft. There's no downtime involved in this. The only thing I tell all my patients, so I'll tell the world right now, if you have a history of frequent cold sores, I would probably pre-medicate you with Valtrex, which is an antiviral medication. Just by having a needle procedure on the lips, if you have a history of cold sores, it can trigger an outbreak. So this is the gal that was on my flyer. What's the difference between the before and after picture? I injected her lower eyelid grooves. I injected her lips 3 times, her lower eyelid grooves 3 times. I could probably get a job like this done today in 2 treatments. This was earlier on in my career, around 2006. But you can see a very natural looking, beautiful result, and a happy patient that looks easily 5 to 10 years younger. Oh, this is a young patient who really doesn't have anything wrong with her lips. She wanted her lips 1 size bigger. I put this up to show that a silicone treatment to the lips is not dramatic. Nobody gets duck lips or overdone. To date, I have not had a patient that has felt their lips were too big after 1 treatment. And most patients, in my view, that are consulting me for improving their aging face, I recommend silicone in the lips to just about everybody, because adding a little volume to the lips is not only it's youthening and it's attractive. As I was going through this talk, when I got to the lip augmentation slide, I just wanted to make a comment about what do we look at when we chat with people, when we have a social interaction. In general, when we have a social interaction with somebody, we start by looking at their eyes. We gain eye contact. And then what ends up happening is the eyes tend to shift. So I'm talking to you, and what am I doing? I'm looking at your eyes, I'm looking at your mouth, I'm looking at your eyes, I'm looking at your mouth. So in a conversation, the eyes of both parties tend to shift from the eyes to the mouth, from the eyes to the mouth, and to have a rejuvenated lips or youthful looking lips is extremely, I think it's very important for achieving as attractive a look as you can. If you have deflated lips, it's going to detract from your overall sense of beauty. And I think patients that are consulting me want to look better when they leave the office than when they came in. This is one of my rhinoplasty patients. She had a nose job. She wasn't happy with the bulbous appearance of her tip, so you can see 1 year after surgery, her tip has a nice narrower appearance. And this is after 3 treatments to the lips. Okay? So this is not a 1 treatment ordeal. This is a 3 treatment ordeal. Patient preference. I go slowly. Liquid injectable silicone is irremovable, so it's one of those things where it's done slowly, 1 to 3 treatments for most applications. This is an example of how a lip augmentation procedure in somebody with very thin lips can be life-altering and transforming. Very pretty patient. Had a previous rhinoplasty by another surgeon. She was left with a slight indentation in the right side of the bridge of her nose. But when I would look at her, she has this almost an aged appearance because her lips are so small. And if you look at the after picture, she's got beautiful green eyes. And when you go up and down from the eyes to the lips, since the nose is less detracting in the middle, it just lends to a very youthful, attractive appearance, no downtime, an office visit with topical anesthetic. And I thought I would show, and this is as subtle as a lip aug can get. So I'm flexible. This is one of my younger male patients who wanted his lips a little bit bigger. This is after 1 treatment. It's very slightly changed. It doesn't look done. It's completely natural looking and smooth to the touch and to the kiss.